On Junior Vets today.
Puppy Willow needs help with a worrying infection. Has competition horse Jack got painful ulcers in his tummy? And it gets close up and far too personal for me when the penguins need vet care.
Who's got it? I'm Alex Riley, and this is Junior Vets.
Pets, wildlife, farm animals, all in need of expert help. And at Edinburgh's amazing vet school, 6 raw recruits have arrived. They're working alongside the school's top-notch team.
As if I just did that.
And they are being pushed to their very limit. As they help to save the lives of sick and injured animals. 6 new junior vets, but I can only choose one winner.
This year's head vet is... Good morning, Junior Vets. We're getting to the end of vet school. There's only a few more chances to impress me and to impress the vets here. So make sure that every job you do it really well and maximise that opportunity. All right, today's pairs are as follows. Bonte and Robin, Natape and Molly, and Josh, you're with Jamie. So off you go. Go and help some animals.
The end is almost in sight, which means I'm going to have to think very seriously about who deserves the all-out head vet title. Jamie's been vetting about all over the place with a big smile on his face, most of the time. Hey, there's nothing wrong with enjoying your work.
Let's go.
Especially when you're working this hard.
You quite happy?
Yeah.
Natape's another get-stuck-in type.
Wow, that is so beautiful.
Vet work is all about connecting with the animals you're working with so you can relax them. I'd like to see Natape really having a go at bonding with his patient today. Jack the competition horse is the pride and joy of vet nurse tutor Caroline.
There you go, boy.
But the big lad hasn't been himself recently and looks like he needs a bit of top-class vet help. Coming your way, Jack. Here are junior vets Molly and Natape.
What's the problem with him?
He's been recently treated for gastric ulcers. So he came in about 4 weeks ago and we found that he had some ulcers in his stomach, so he's been treated.
Hopefully Jack's stomach ulcers are getting better, but if they're not, he could be feeling really poorly and uncomfortable.
Right over his ears.
Today, the team needs to check if Jack's condition has got better since his last check.
It's really bad when you have a mouth ulcer, but to have one in your stomach, I can't really imagine what it'd be like.
Fine.
It's really cute. Really calm as well.
The junior vets need to move Jack for his checkup. He's nervy around strangers, so nice and easy, you two.
I'm scared that he might step on my foot.
Jack's ready for his stomach ulcer check. Top horse vet John is working with Molly and Natape on this one.
So we're going to re-examine him and find out if his stomach's got better.
They're going to have to use this long, bendy endoscope camera to take a peek inside Jack's stomach.
He seems really scared. Like his eyes just seem really scared.
He's looking a bit nervy. So good calming skills, Natape.
I think Jack really liked you because as soon as we turned the corner, you were like stroking him and giving you all your attention. I think he really liked it.
I bonded with Jack really quickly, which was unusual because he was quite scared of everyone.
That's confident work.
That's good.
Jack's safely into position. And we'll soon find out if Molly and Natape have the stomach for endoscoping.
Oh, that's amazing.
At Edinburgh Zoo, giant creatures need Jamie and Josh's help. What do you mean these aren't giants? These are the world's largest land snails.
Oh, they're massive.
See?
These are giant African land snails.
Vet Romain needs some help with these monster-sized patients, and Jamie may have spotted why.
Oh, they got cracks. Shells.
Yes.
Yep, shell damage. It can be a life-threatening problem for snails. This armour protects their soft insides from predators.
Well, have a look at them. You've got gloves on, so I'll give you one each to hold.
I mean, you've got your garden snails, and then you walk into a zoo and you've got these massive ones.
Ooh, I'm stroking a snail.
Yeah, it's a bit strange, isn't it? You okay? Not too worried? I know some people are worried about snails, but they can't do anything to you.
It doesn't feel as slimy than I thought it was. It's just sort of like sticky.
I was quite surprised, actually. They weren't as slimy as I thought they would be. Yeah. They just sort of want, like, let go.
Yeah. Hello. Snail meet snail.
I was a bit scared because with my hands, I thought they'll just take one hand, not two.
Yeah.
I want one.
Introduction's over. Let's get some vet work done.
There's a big dent there, like someone, if that was a car, someone's bashed into the car. It's difficult to know how much of a problem it is. But sometimes they're a bit silly and they start chewing away at each other's shells, and they don't have teeth, but they have like a kind of a tongue with little hooks on.
You walk in, you see they've got cracked shells. I thought, oh, they've just banged on against a rock or something. No, they've been eating each other. Wow.
What I'll do, I'll get a swab here with a bit of water, and you can just clean his shell a little bit for me, especially where you see that nick is.
The team give the snails a quick dip and carefully clean around the broken bits,
Oh, that feels weird.
so they can see how serious the shell damage is. Now make sure you don't get water in the snail's lungs, chaps, because a snail doesn't breathe through its mouth, it breathes from an opening under its shell.
So if you look carefully, there's a little hole, okay?
yeah.
That's like a big nostril, okay? And that's where a snail breathes. If you look inside, that's actually the inside of his lungs, and the lung goes up the shell.
We had to make sure that no water went down, because it could have infected it, and it could have, like, well, if it got a really bad infection, it could have killed it.
Do the cracks mean like that they could have an infection?
An infection or some bacteria could get in there. So we're just going to scan them to make absolutely sure.
The shell damage seems minor, but an ultrasound scan will show if there's any further damage hidden out of sight under the shell.
Yeah, what is that?
So that is the gut. That's pieces of food inside there.
Can you believe we're actually doing an ultrasound on snails?
Any serious health problems?
I'm not seeing anything that looks like a big infection or a hard lump or anything, so that all looks quite good.
All good. Now the team use the ultrasound to check to see if their snails are pregnant.
I don't see any eggs in these guys.
Eggs? I'm confused, and I think Josh is too.
Are both of these boys or?
Ah, now that's a good question because they're both boys and they're both girls. So all snails are both. They'll mate with each other and then they'll both get pregnant. So it's very strange, isn't it? That's why they're so interesting. They're so different to us. They'll all lay eggs and they're all boys.
And they're all girls.
And the good news is these guys, girls, let's just say snails, are all fit and healthy and can return to the peace and quiet of their enclosure.
Well done, you little chum.
And Josh and Jamie get outdoors when grumpy penguins need handling with extreme care later.
Come on, girl. Oh, you're trying to swim away.
This is 7-month-old puppy Willow. She might look all playful and happy, but she's having an uncomfortable time whenever she wants a pee. So it needs sorting. To vet school, Willow. Because Bonte, Robin and Vet Tracy are waiting to help you out.
She a Labrador?
No, she's a golden retriever. Her name is Willow.
Hello, Willow.
She's a little bit, yeah, you can say hi.
Yeah, when Willow came in and I saw her, it straight away reminded me of my dog. I started getting, not upset, but it was just reminding me of it. Oh, you are so cute. Yes, you are.
Willow came to see us because she has been having bacteria that go up into her bladder where the urine sits and causes her to have a lot of discomfort. So she feels like she has to pee a lot. Do you know what we usually treat bacteria with?
Is it antibiotic?
Yes, good.
Willow's already had lots of antibiotics to fight an infection, but they haven't worked. The vet team need to find out exactly what's causing this problem.
Okay, Munchkin.
So they're going to take a peek inside of Willow using one of the vet school's scanners.
A bit more. Is that to make it more clear so you can see more?
Yeah, exactly. So it helps get in really good contact through the skin so we can see inside really well.
Okay. So we start.
Oh, look at that! Willow's insides.
Is that a bladder?
Not a bladder.
intestine?
Not intestine. It's
Kidney?
part of it. Good. It's a kidney.
So what does the kidney actually do, like when water's traveling down?
So the kidney takes all of the liquid from our body and clears out all of the waste material and keeps the water behind.
But straight away, Tracy's expert eye tells the team that Willow's kidneys are not the source of the problem. Next, the team move on to her bladder, where her wee is stored.
That a bladder?
That is her bladder. Good.
Tracy told us that on the ultrasound to look out for like darker bits.
Darker areas would mean Willow has a healthy bladder, but that's not what they're seeing.
Is there anything there that's abnormal?
The only thing that's a little bit unusual is all of that speckling in the bladder is not normally there. So that would make me think that maybe she does have something in her urine, like she actually has an infection right now.
That's not good, but just how serious is it? All will be revealed when we catch up with these two junior vets in a bit.
Is that normal?
It's not.
At the equine hospital, Natape and Molly are helping competition horse Jack, who's been suffering with stomach ulcers. The team are trying to work out if the problem is improving or if he needs more medical treatment.
Hello, junior vets.
Hello.
What are you up to then?
So we're going to be getting this camera and we're going to stick it inside his stomach because he's had a few stomach ulcers and he's had treatment for them, so we're just going to check that it's been cleared.
Before Jack can be sedated, the junior vets need to help vet John give him a thorough examination.
It's really important that we know his heart's working properly, because if it's not working properly and we sedate them, it could make him too sleepy and then he might fall over. So first thing we're going to do is have a listen to his heart, and you're going to tell me what his heart rate is. Here you go. And you've got 44, so 32 to 44 is a normal heart rate for a horse, so that's really good.
Good news, but a warning for you lot. Things are about to get all horrible looking. No, not me. Jack is about to have his internal endoscope examination, and it could be a bit... Ugh.
Let's have a look in your nose to see if you've got any bogies.
Up goes the camera. It really doesn't hurt Jack.
Okay, his food tube is just behind there, so we're going to go into his food tube.
Oh, that's amazing.
It's probably a bit scary and tickly. Bless you, Jack. But Natape is doing a top job keeping him all relaxed.
It's okay, good boy. Doing really good.
I think you did really calming, because when we stuck the endoscope up, you were like giving him all your attention. I think he liked that.
Wow! At last, we've got the bendy camera up Jack's nostril and right into his stomach.
Is that the acid?
Yeah, that's the acid fluid exactly in his stomach.
I think it was disgusting to look at, because when we were like controlling the camera, there was all this liquid and it wasn't very nice.
Oh, and you see that yellow stuff coming out of there?
Yeah.
That's bile coming out of the small intestine.
There was like loads of different tubes and it was really weird.
I can imagine what it'll feel like, because like when you get a blocked nose, it feels swollen and stuff. It's not a very nice feeling.
No. Before the treatment, what did the ulcers look like?
Instead of being pink there, it would be red. It's a little bit red in there, isn't it? But they're not very... This, it's not too bad.
Jack's stomach is still inflamed, but some medicine should sort that out.
The marks where the ulcers were quite clear, but they were obviously getting better because like they weren't red, they were pink.
I was really pleased when we saw that the ulcers were getting better because that meant that Jack could now eat.
Best let Jack's owner, vet nurse tutor Caroline, know the good news.
No need to worry, Caroline. We've had a look and the ulcers are still there and they'll probably still be a bit sore, but they should be okay. And if we carry on with his medication, then everything should be fine.
You should also let him graze a lot so the saliva will dilute the acids in his tummy.
Great. He's nearly got as many freckles as me.
All Jack's internal checks are complete. It's been a bit of a stressful day. I reckon he deserves a good scratch on his favourite spot to chill him out.
Both hands game. Oh yeah, look at it. Oh, he's moving back. He wants you to go a bit further forward.
I found his tickly spot, but I don't think I found it. Like he showed me where it was. So yeah, because he was keep moving forward and backwards to try to tell me where it is.
Ah, left a bit, right a bit. There you go.
Oh, I love that.
Right, dinner time. The big lad hasn't been able to eat since yesterday. I bet he's so hungry he could eat a horse. I'm joking, Jack.
Hey, Jack.
I thought they were fantastic, actually. I thought they really engaged with the process and engaged with Jack as well and with Caroline. Nyatope in particular actually seemed to really interact well with Jack. He did a great job, actually, of making Jack feel comfortable about the whole procedure.
He's got very bad table manners.
With Caroline being a vet nurse herself, and then we were having to tell her how her horse was. It was quite scary.
I think I've done quite well with handling the horse because like I think I've gained quite a lot of trust from him, and yeah, he's just really nice. He's a really nice horse. Found out that I kind of like horses.
Jamie and Josh have been called to work behind the scenes at the zoo. They've even let me join them. And penguins need vet help next.
Look at him, look at him.
Look.
We're not sightseeing today, though. There's important work to do here.
I love the penguins. But like, you go to all the zoos, you see all the penguins, it's like you never picture yourself being actually in the enclosure with them.
I wouldn't even thought you would be allowed in there because you don't know what they're going to be like.
How does it feel to be this close to actual penguins?
It's amazing. Or you really only ever see them like from behind bars or like on the TV.
Vet Romain is worried some of the penguins may have picked up injuries and illnesses.
Romain needs to give like most of the penguins a close-up inspection just to make sure they're all okay.
Let's move you. These guys are a bit of a nibblers.
Oh, just got nipped. Just got bitten.
When they pecked Alex, it is really funny.
Cheeky. Let's focus on the Gentoo penguin with a bent beak, please.
Just take your head gently, so she gets a little bit stressed, this girl. The tip of the beak has started to grow skew.
Romain thinks the wonky beak might be making it difficult for the penguin to eat and wants a closer look.
Come on, girl. Oh, you're trying to swim away.
It's okay. Why do they have, like, spikes in their mouth?
So if you think if there's a slippery, wet fish in your mouth, it's quite easy for it to escape or to slip out. So if they grab a fish, it won't slip out.
You wouldn't see this every day, would you?
There's no point in me going and trimming this now. What we'll do is, in about 2-3 months, we'll see. And if I need to, I can just clip or wear down a little bit of that beak just to make it a bit better.
All good. Romain is happy that the wonky beak is not a serious problem. So, after a little strop, the Gentoo is good to go.
As vets, would you be able to give that bird a clean bill of health?
Yeah.
See what you did there?
This guy's nickname is Mr. Hippie.
Mr. Hippie's had an infection that could have affected his appetite. My junior vets need to see if he's looking and feeling underweight.
Pop your hand here and just feel there.
Oh,
What do you feel? It's like a ridge and there's muscle on either side, so it gives us an idea of how thin or fat a bird is, how they've been eating, how they've been moving.
Yeah, I'm touching a penguin. Didn't think that I would, like, touch a penguin, but, like, it was just amazing.
Basically, Romain said we needed to take like a blood sample to see if he's got an infection.
And that's where the vein actually runs. Now, the problem is that penguins...
Do you mind? We've got serious vet work to be done here, sunshine.
Yeah, you're so cheeky. You usually come and cause trouble.
I'll keep an eye on the rockhopper penguin. You lot focus on getting Mr. Hippie's blood sample.
You hold it on. You need to squeeze it on tightly. So squeeze, squeeze, squeeze.
Done. And Mr. Hippie heads back, cool as you like.
Oh.
There we go.
Good luck with the blood test results, Mr. Hippie.
See how he walked away then? He was like, hey, come on, oh, I wasn't frightened.
Alex's impressions aren't the best. I could have done better.
I could have taken him. I'm a tough guy. Yeah, what it is, they don't want to laugh because they don't want to appear unprofessional in front of the actual vet, so they're trying to win the Vet of the Day award. Weren't you?
Onwards. I have to admit that Josh and Jamie have taken to being zoo vets like penguins to water.
Oh, it was amazing, even though it has been raining.
So, Romain, how do you think our junior vets did today?
I think they did really well. Jamie had a good grasp of the kind of things that go through my mind.
OK, so he's sort of thinking along the lines of a vet already.
I think possibly what he's been exposed to is already starting to rub off on him.
Back at the small animal hospital, Robin and Bonte have discovered a problem with Willow's bladder. An ultrasound scan suggests the puppy has an infection, but they have no idea how serious the illness is. So the team have to insert a camera directly into her bladder.
So essentially the area that we need to clip is kind of a rectangle up there and then kind of the base of her tail.
You can leave the prep work to my junior vets, Tracy.
Okay, that looks great.
So if you start at the middle there and then just work your way to the outside.
Great.
We had to make sure that she was completely sterile so we could like avoid the further infections and stuff.
So this is the scope that we're going to use to go into her bladder, and this is the sheath that is outside of the scope that helps protect the scope.
It's like if you touched a bit of her skin with the scope without sterilising it, it could give it a bacteria inside.
Exactly.
This tiny high-tech camera probe is super sensitive, just like patient Willow.
Is there any risks with using that?
I mean, it's quite hard. It's a metal rod. So you could poke through the side of her bladder if you weren't watching where you were going.
Oof, serious focus required here then.
Were you worried about what they were gonna find?
Yeah, because she hadn't like really give us a clear idea what it was going to be, and I was really worried that it was going to be something serious.
Do you guys see those little white dots all over the place? That's not normal. It should be all nice and pink and healthy.
That's not a great sign. The team need to explore further.
You can actually, do you guys see?
Whoa, that's the probe flashing under Willow's skin. It's showing that the camera is in the right place.
There's lots of things sticking out. Okay, so now I'm in her bladder.
And the images confirm Tracy's fears.
Do you remember how with the ultrasound we saw all that speckling?
Is that what that is?
That's what all that grainy stuff is.
The bits that look rough, is that normal?
It's not. It's not terrible, but it isn't quite 100% normal. She has evidence of kind of chronic infections.
Poor Willow. This infection must have been making her feel really unwell. But it's not all bad news.
Okay, all done.
Vet Tracy is confident that Willow does have a brighter future.
So I think she's just a dog that has chronic urinary tract infections, so we just need to make sure that she's on the appropriate antibiotic for long enough to really get rid of the bacteria.
So will she always have it?
Hopefully we'll be able to control it, that she will be able to get rid of the infection so it doesn't ever come back. Good job, guys.
it was really good to know that Willow was going to be okay because she was still going to have the infection for a bit, but it was going to get better.
So how do you think Bonte and Robin did today?
I think they both did great. I was really impressed. They both did a great job of clipping the patient and really kind of working through the case with me today. Especially Robin. From the first moment we started working, she was full of questions, firing questions at me faster than I could actually keep up with her. So I was very impressed.
Ah, look at this lot. All back together, nice clean scrubs and germ-free. I bet they're dying to know who I'm going to name as Vet of the Day.
Another brilliant day of vet work, if I may say so. Have you got what it takes to keep on going, to keep on pushing on until vet school graduation? I'm sure you have. You're brilliant. But who will be Vet of the Day? Well,
Will it be Jamie and Josh? They were great with the giant snails and got well stuck in with those feisty penguins at the zoo. Or maybe Molly and Natape, who looked after Jack the horse really well when that camera got right up Jack's nose. Natape was by his side to calm him down. But then again, when Willow, the puppy, needed a tricky internal investigation, Bonte and Robin took it all in their stride. They were all great. But today, for me, it was an individual who really impressed.
my vet of the day is a junior vet who's well known for being fantastic when it comes to the physical aspects of the job. But on this occasion, this junior vet showed that he had a gentle side, a caring and compassionate side that was wonderful to see. And so for that reason, my vet of the day is Natape. Congratulations, well done. Well done, Natape, very good.
Top-notch vet work from Natape all day long.
I feel really happy that I've won because I like that animal so much. That's what made me win.
Well done.
Right, shall I go and do the poop?
And just a bit of poo cleaning for the gracious losers.
This is quite a good chore, actually. Yeah, you get up close to animals. Yeah.
Next time, my junior vets take charge at the pet show. They're in the water working with sharks, and they're helping little dog Nisha when she needs major knee surgery.